Thanks, David. So we have a few minutes for Q&A. If anyone has a burning question out there, raise your hand. We've got some microphones going around. I was going to start, but we've already got 2 hands up here, so go for it, Ned.
Sure. So in our campaign, the geofence locations were actually drawn around the boundary of those like physical building locations. But to your point, that is another limitation of the geofencing is if you have individuals who are going to those for work, they might be coming through that area multiple times per week. So just something to consider.
Right behind you with the mic.
Thank you. Hi, I'm Alina Huber from Louisville Metro Public Health and Wellness, and I wanted to see how much the geofencing cost and if you all from the local health department funded that yourself or if you were able to get grant funding.
Sure. To answer your first question, I'm not sure exactly how much it costs, but I can put you in touch with our public information officer, and he should be able to give you that info. We actually received funding from, I believe it's our ODH HIV STD grants to do campaigns, and one of the venues that we used was the geofencing part. You're welcome.
And we've got a question in the back.
I also have a question about the geofencing. Could you talk a little bit more about the process that your team went through to identify the sites that you wanted to geofence?
Yes. So again, we have like 4 or 5 disease investigation specialists at our health department. And so they are the ones that go out and interview the HIV and syphilis cases and do partner follow-up. So we sat down with them as well as the media team that we were working with, and they went through and, from a list of places identified if we had to target someone based on their location, what institutions would be the best places to do that. I actually wasn't involved too much in that process, so if there's more details needed, I can put you in touch with our DIS supervisor.
I do have one question for Dr. Saddler to give her a little bit more time up here. I know we're all hooked in on the geofencing. So I know you talked about the data sharing agreement and kind of shared that slide really quickly, but I know the long process that was. So any tips for anyone? I think that was such a valuable source of data for the project and something that we haven't leveraged that way before. So if you have any tips for people trying to get something like that in place.
And I've got some staff here too who probably have some helpful hints and tips. Raise your hand if you were involved in this at all. Okay, so one of the things that I would say is a helpful tip, I know that we collectively had looked at some other model agreements in other parts of the country to get a sense of what needs to be in there. And really, I think the most important tip is that anyone that works in healthcare is very sensitive to privacy and HIPAA, and so you have to reach that point where the parties feel comfortable and feel safe that people's information is going to be protected. And so whatever you have to do to get to that point and embody that in the agreement. But really, it's looking at other model agreements, and our agreement to see what elements probably are going to have to be in there to protect data and protect people's privacy.
Do we have time for one more? Oh, I'm getting the stop sign. Okay. Well, I'd like to take another minute just to thank our panelists for the wonderful presentation. If we could give them another round of applause.